Annually, 1.1 North Americans suffer concussions, which are caused by a variety of events. 1/5 of high school football players suffer concussions yearly. Today, the Center for Disease and Prevention, or CDC, reports that a concussion is a type of traumatic brain injury caused by a bump, blow, or jolt to the head that can change the way the brain normally works. The skull is a protective structure that is supposed to protect people's heads from any type of injury. However, when a blow is too powerful, the brain can move within the skull. The brain violently knocks against the skull, and this results in a concussion. The nerve cells in the brain can be torn and the chemical balance is changed. There is no outside structural damage, but there are functional disturbances. Concussions seem to be most prevalent in the sports community because there is more awareness for them. Despite this, many coaches, athletes, and parents do not realize how dangerous it is for the athlete to return to play before their brain is ready. According to the American Academy of Neurology and the Brain Injury Association, concussions can be divided into 3 categories of mild, moderate, and severe. A mild concussion can include some confusion, no loss of consciousness, and the symptoms should be gone in about 15 minutes. With a moderate concussion, the patient might be confused with no loss of consciousness, but the symptoms last longer than 15 minutes. The third type is severe. This is when the patient has lost consciousness and it will take a long time for them to recover from traumatic symptoms. A person can get a concussion from doing almost anything. Most happen during contact sports or vehicle accidents. However, concussions seem to be most prevalent in the sports community because there is more awareness for them. The recovery time can vary from each individual, but typically takes about 1 to 2 weeks for concussion symptoms to resolve and for the brain to begin operating back at full capacity. A concussion can be recognized by a multitude of symptoms, including headaches, nausea, vomiting, drowsiness, numbness or tingling, dizziness, balance problems, sleeping more than usual, difficulty concentrating, difficulty remembering, sensitivity to light and noise, feeling slowed down, feeling as if in a fog, trouble falling asleep, more emotional, and nervousness. Severe symptoms of concussion are having one pupil larger than the other, looking very drowsy, or having convulsions. After receiving a concussion, any of these symptoms occur, but may take a while to appear. Certain combinations of symptoms can occur, but the number of symptoms or which symptoms occur does not determine how bad the concussion is. Along with these general symptoms, there are physical, cognitive, and emotional effects. The first thing that should be done when someone receives a head injury is to establish if there is any loss of consciousness. Loss of consciousness is a rare occurrence and occurs only in about 10% of those who are concussed. When it does happen, it should be taken seriously and the person should be taken directly to the hospital. The patient needs to be examined by an athletic trainer for any signs of symptoms associated with the concussion. Sideline testing can include testing of the patient's balance, vision, memory, coordination, reflexes, and concentration. The person that was hit should be immediately taken out of the activity and not allowed to return until cleared by medical personnel. If they do return to play, they are risking more injury because of slowed reaction time or impaired coordination. All concussions are different, and that is why it is difficult to determine how long a person can be out of their activities after they receive a concussion. The number of previous concussions can affect the severity of the concussion, as well as comorbid conditions such as ADHD, learning disabilities, and mood disorders. Other possible factors that influence recovery is the magnitude of force from the original blow, the part of the brain that was hit, the size of the object or person that caused the concussion, and the speed at which it happened. One important factor that helps doctors determine the severity of the concussion is a baseline test. IMPACT is a computerized test of memory, reaction time, visual and motor speed, and other cognitive tasks. A baseline testing is performed pre-season so that it can be used for comparison after a student is injured. Other tests, such as the ACE or SCAT tests, are also used to track the patient's progress. Even though the damage of a concussion takes place in the white matter of the brain, disrupting the neurological connections, there are certain physical problems that could occur, such as internal bleeding, brain swelling, or skull fractures. This is where MRIs and CT scans can be helpful. These tests are recommended only when there is prolonged unconsciousness, major mental changes, or changes in the neurological examination, or if the symptoms progressively worsen. The treatment for a concussion is rest, and more rest. This will allow time for the brain to heal both physically and mentally. It is very important for the patient not to rush back into daily activities, including reading, schoolwork, watching TV, using a cell phone, or other activities that involve screen time. This can be very difficult, especially for those who are used to being on the go and participating in fast-paced sports. Resting will also help prevent re-injuries. One must avoid contact or jolting of the head, including driving, working at heights, riding a bike, or using heavy equipment. This will create new damage that the brain will have to recover from on top of the original injury. Second impact syndrome is very dangerous and thankfully very rare. It occurs when an athlete returns too soon to play. They get hit again while their brain is still in a vulnerable state. Second impact syndrome has resulted in 30 to 40 deaths over the past decade. Limiting medications is also essential to a faster recovery. Medicines that include blood thinners, aspirin, and pills for drowsiness should not be used as they could cause other complications. Brain food should be eaten to speed up the repairs to the brain. Many doctors say that patients should also increase their daily calorie intake. They can do this by eating foods such as eggs, avocados, almonds, and berries. Foods high in oxidative properties and healthy oils are recommended as well. By far, the hardest thing to do when one has a concussion is to sit out life. When a person gets a concussion, their life is put on hold. No social events, no sports, no school. One cannot return to their usual activities until they are symptom-free. They first must start with baby steps and gradually work up to their normal activities. For an athlete to return, there must be first asymptomatic after rest. If the patient has no symptoms for 24 hours, they may return to a light aerobic exercise. If they have no symptoms, the next day they may graduate to sport-specific training. However, if any of their symptoms reoccur, they must return to resting until they can participate in small activities with no symptoms. The patient may then do non-contact drills, continuing on to full contact drills. After taking part in these activities with no symptoms, the patient can return to full-time play. Returning to play in school is a gradual process. It will take time and the patient should take breaks as necessary. The patient should return to school at the same pace as returning to sports, taking each day slowly and increase their workload at a slow and steady pace. An overwhelming amount will just result in their symptoms coming back. If the patient returns too fast, they can become significantly vulnerable for more problematic consequences of a second concussion. This goes along with the saying, haste makes waste. Having a concussion is a scary and difficult process, especially if the patient has never had one before. The patient may become anxious, nervous, and overwhelmed with mixed emotions. One of the most prevalent emotions with someone with a concussion is denial. No one wants to believe they are injured and cannot return to their normal activities. The best thing to do for someone who has just received a concussion is to give him or her space. Observe them for increased difficulties paying attention or remembering information. They are going to require a longer time to do their assignments and may have greater irritability towards random things. Some of these symptoms are normal teenage behavior. According to Dr. Parker, an impact specialist at Bull Run Family Practice in Manassas, it can be hard to differentiate between someone who is looking for attention or not. However, first you have to establish that there was a head injury. There may be a certain degree with emotional overlay, but we can tell on the basis of physical findings if a concussion has occurred. The patient may start to feel frustrated because they cannot participate in normal activities like they are used to, but it is important to be patient with them and help them find resources to get better. There is no absolute way to prevent a concussion. Helmets help by absorbing some of the shock sustained during the activities, therefore minimizing the effects of concussion, but not stopping them altogether. Seatbelts and airbags are also preventative measures that are put in place to prevent any type of head injury. Education certainly is an extremely important role in preventing them. Out of 50 states, 43 have passed laws concerning concussions and preventing athletes from returning too soon to play after receiving a concussion. As of April 11th in 2010, each school district in Virginia must have developed policies for dealing with student-athlete concussions. This includes requiring an evaluation by a licensed healthcare provider and getting written approval before allowing them to return to play. A concussion can be a mild traumatic brain injury, but it can also be deadly. If not treated properly, it can lead to problematic brain development. Repeat concussions can lead to learning and psychiatric problems. One of the long-term effects of a concussion is post-concussion syndrome, or PCS. Post-concussion syndrome results from the changes in the brain that don't show up in medical tests. They may be present in the victim with a concussion with symptoms that last for an extended period of time. They don't get better within the usual 2-week recovery period. The symptoms from PCS can overlap with those of a first concussion. In severe cases, this can be permanent and disabling. It can result in chronic cognitive and behavioral difficulties. Those who suffer more concussions are more vulnerable to become clinically depressed and even some susceptible to suicide. Concussions are a type of traumatic brain injury that can be caused by a collision with another person or object that causes the brain to knock hard against the skull. The severity of this impact ranges from mild to moderate to severe. When someone receives a concussion, they need to be evaluated by trained medical personnel to determine if there was loss of consciousness. They then must seek help from them to determine the severity of the concussion and the treatment plan. The brain heals after much rest from school, sports, and normal activities. Return to school and play is determined by recovery from the resultant symptoms. If return is too soon, they run the risk of getting another concussion, which results in second impact syndrome. Many people do not realize how long it takes the brain to heal and how dangerous it is to return too soon to play. A concussion can be physically traumatic as well as cognitively. Resultant long-term effects such as chronic depression and suicide can result. As more people become aware of the dangers of concussion, the physical and cognitive trauma may be avoided.